Hi, Geoff. Hi, Moira. Great to see you both, and thanks so much for for joining us today to discuss a really important initiative with the Hazelden Betty Ford Foundation. Obviously, we're going through spectacularly difficult times for everybody, and I mean spectacular in a bad way. Difficult times for everybody in the world with the COVID crisis, which has obviously created a lot of other crises and a ripple effect throughout people's lives, their families, the sports production industry in general. So we're here to discuss a really important project that we are working with the Hazelden Betty Ford Foundation on. And Geoff, I want to kind of have you introduce yourself, because I'm not sure, probably not everybody necessarily knows who you are. So Geoff, give us a little bit of background about as a Sports Broadcasting Hall of Famer, how you got there, but also your involvement with the Hazelden Betty Ford Foundation and how that came about.
Thanks, Ken. Yeah, it's a very personal connection I have. Way back in 1983, excuse me, I was having all kinds of success in the sports production business, but underneath that veneer of success was a pretty serious addiction to vodka. And at one point, I just decided I can't do it anymore. Not many people knew. I was pretty good at covering it up. So I went out in September of '83 and checked myself into the Betty Ford Center. And that was to be the beginning of a pretty healthy, productive life for me. I, by total coincidence, met Mrs. Ford the night I got out of Betty Ford. And we talked about a lot of things that night. And among the things we talked about was creating an alumni association so that people like me who were going back home after having spent time at the Betty Ford Center would have like a network of support and people they could call on. So that's where I spent a lot of my time in my early years of recovery. She ultimately asked me to join the board of directors, which I did for, I guess, 15, 16 years. And, I've stayed involved ever since. I lived down in Naples. I spent a lot of time at the Hazelden Betty Ford place here in Naples, Florida. And for me to understand better the overwhelming need out there, especially during these, excuse me, challenging times we're going through, helped me arrive at a point where when we at SVG were having success dealing with this COVID issue, how to do TV shows of sports and how to keep our people safe, I began to sense that maybe we at the Hazelden Betty Ford Foundation could become a resource for our industry to help people who are going through, whether it's a bubble in Orlando or isolation at home. We are a good resource for helping people through these challenging times. And so I called you, Ken, and I said, hey, what if we could create a partnership? I'm pretty well known in the Betty Ford Foundation, Hazelden Betty Ford Foundation, and we do good work. And we do the kind of work that I think can help our constituents at SVG and in the sports production industry. And I called my friend Moira and I said, hey, we have a need. We can feed patients with need to Hazelden Betty Ford. Why would that not work? And she said, I have no answer for that other than let's do it. And so the rest, as they say, is history. She has been the spearhead of getting this thing done, for which we'll always be grateful. And I'll let her explain what it is they want to provide us.
Yeah, that'd be great. Yeah, Moira, I mean, I guess from my perspective, I think when people think of Hazelden Betty Ford Foundation, obviously they think about addiction treatment primarily, right? But there's a lot more there, and it's about a lot more than just support for people who are dealing with addiction themselves. So can you walk through, the programs that are offered and where people can kind of fit in as far as solving some of their issues and getting some help?
Absolutely. Thanks, Ken. And thank you, Geoff. I first want to start with how excited we are at Hazelden Betty Ford about this partnership. We've been working a long time, kind of person to person, as Geoff mentions. Obviously, he was with us many years ago, and we continue that work. But these types of partnerships are really important to us because we know that there's large communities that are suffering right now, right? Especially during this time. We know that alcoholism is up, overdose deaths are up, mental health issues are up. And so to be able to work with SVG in this way and hopefully have a big impact means a lot to us and our mission. So just want to start with that. So we're looking forward to this partnership. But absolutely. So when people think of Hazel and Betty Ford, or what they know of Hazelden and the Betty Ford Center, is addiction. But we have a lot of services, actually. And let me just first talk about some of our addiction services. So, first of all, depending on your need, we have services ranging from residential, and that's kind of what people think about, right? They think about people going to rehab, going to a center to get help. We have that. But we also have virtual services, especially during these times. You have the opportunity to step into virtual services and begin to get treatment, just like how we are today via Zoom or whatever. We have a different platform, but a medical platform. And we also have many different levels of care. So first and foremost, I think what's important is if you think that you might have a problem, if you're curious about what the opportunities are to get help, call us, because we can help you figure that out. But then also we are a mental health provider too. So if we also have mental health services. So you also have the opportunity to get mental health help from our psychiatrists at the Hazel and Betty Ford Foundation. We have about 86% of individuals that come to us have what we call co-occurring disorders. So not only do they have addiction, but they also have mental health. And you can get care for both or either. So we don't discriminate. We want to help as many people as we can. And that's about the individual. In addition to that, so let's just say that you're someone that maybe is already in recovery. We also have services for children. So anyone can call us at any time, and we have children's services. So that means individuals that maybe they themselves have suffered or are suffering right now as adults. If you have children, we ask that you put your children through the children's program. And that's for kids from 7 to 12 years old, all funded through philanthropy. So it's donor supported, it's free. And I say intense, not intense in a negative way, but a very concentrated, very child-friendly focused help for kids. It helps children understand that it's not their fault. Helps children understand that there are other children like them. 1 out of every 8 families deal with addiction. So that means 1 of every 8 families and their kids, these kids are suffering. So I think that's a really important thing for everyone to know, is that any child can enter this, whether you go through our services or not. I think that's really important for everyone to understand. And then lastly, we have what we call a family program. This family program in normal times is a 3 to 4 day on-campus experience. But right now it is a 2-day experience, 6 hours each day. So it's a lot of Zoom time, but we've actually had some people that had already done the day and now have kind of done a refresher with the virtual, and we're getting really positive feedback about that. So again, that is through philanthropy, through our donors, is free. So whether anyone goes through our services or not, family members can go through our family program. And the really important thing about that is addiction and mental health are very misunderstood diseases, right? People don't know, even if they have all the signs, people don't even know, they still question, is this something I should get help for? Right. And it's very much a family disease. And so it is really important that if you or a family member decide to get help, that you also do take advantage of these other resources, because it really permeates families, and families need to be put themselves on a path to recovery too. So those are just a handful of some of our services that we provide.
Gotcha. So as far as, walk me through the, I think for a lot of people, the intimidation is making the call, right? I mean, first of all, acknowledging that they need to make the call, but then picking up the phone because they don't know what the experience can be like on the other end. And I'll say that, for a lot of these programs can be very expensive. So I think a lot of people will sit and say, well, I can't afford it, so I'm not even going to bother doing this. So what's that process like? And then where do you see things like insurance or other grants fitting in to kind of alleviate some of the costs and stress?
Before Moira gets into that, let me just say that I think one of the best elements of this partnership is when you make that contact, you make it through exclusive phone numbers and email addresses, okay? Right. We have our own front door, as it were. So it's less intimidating, less waiting time. The SVG constituents are put, quote unquote, at the head of the line. Go ahead, Moira.
Mhm.
Right.
Absolutely. Thank you, Geoff. That's a great entry. So if there's many ways to gain access into the Hazelden Betty Ford services. So if you were not part of SVG, you go to our website or in a 1-800 number and you pick up, and we have a call center that, takes care of people, and we do a good job at that. But what SVG, because of the special partnership, we have, it's more of a concierge line. So we have a group of team members that work with partners like this. So, today they're ready for the SVG team to start calling or emailing them. They've got the name and the alerts on their computers so that if the calls come in, that they know that you're a special partnership. So I think that's really important. I appreciate you calling that out, Geoff. So you'll pick up the phone and call the team, or you'll go to that special email that's been provided to you. And those individuals will walk you through your options. They're going to ask you questions, almost do like a self-assessment over the phone, because what we have to determine is what kind of help do you need, right? If you can start an outpatient, whether because of your level of acuity or because of your personal circumstances, we're going to start you there. But if you have a higher level of acuity, we're really going to recommend that you come for residential care. But that's the kind of conversation you're going to have. Another part of the conversation is finances. That, like all healthcare, is always a barrier. And so we are in network with most insurance providers. So I think come in assuming that you're going to be able to get help. So make that assumption, right? Because like I said, we're in network with almost all providers. So you after you have that conversation, they will make a recommendation / estimate of what your insurance will cover, right? And so as you go through the process, it just like all healthcare, it continues to uncover itself, right? But the estimates are usually good. And depending on your insurance provider, you might get 10 days taken care of, you might get 25 days, right? And so depending on what your insurance will cover, if there is a gap based on what insurance will cover and what we recommend, that's when there's other opportunities. And that I think that Ken, I'll put it back to you, but, are there opportunities with SVG to partner around funding? I'd say also we as an organization, we do help with patient aid. There's certain parts of the process. For example, if you come into our care and you're in residential and we recommend that you go to the next level of care, we know insurance does not pay for room and board at the second level of care. We have donors across the country, as well as we as an organization have, we'll put in at least 5% of our revenue back to the organization to make sure that individuals continue to get help. So we also have gaps throughout the process that we've identified that we help individuals. And SVG, just like all patients, would be qualified for that too.
Excellent. Yeah, and SVG, we do have a sports broadcasting fund that can also be available to help out as well with some of the costs. So our goal is to obviously make sure that people know how to call, that that the conversation will be a good one. It's not going to be, trying to be sold, if you will, on thousands and tens of thousands of dollars of treatments. And then also the fund will be there to help out as well. So Geoff, I just want to kind of close out with, going back to your experience and talking to people over the years. What do you see as the challenge for, making the call before you totally hit a total crisis moment, usually a terrible incident that kind of kicks us off. What's sort of your advice to people to evaluate, their own place with respect to their opportunities here to kind of get some help, how they can make a proper evaluation and look in the mirror and figure out before it becomes a really difficult situation where somebody gets hurt or that kind of stuff?
I tell people, Ken, it can be a scary process, but the way Moira described and the way I have experience within the framework of Hazelden Betty Ford, it doesn't need to be a scary process. We are in the business of offering hope to people who need hope, who aren't feeling good about themselves, who want help, but in many cases are afraid to ask for it, afraid how to ask for it. So we try to make our resources available in a, if you will, a very loving and compassionate way. We've been in the business a long time, and we know how to do that. So I tell people, look, you don't have to feel the way you're feeling right now. Your kids don't have to feel the way they're feeling. Your wife doesn't have to feel, or husband doesn't have to feel the way they're feeling right now. There is help available. And it is not necessarily as intimidating a process as you've heard, quote unquote. So crossing that bridge is a process. The most important step is making, I tell people, is making that first call. The fact that you're talking to me and inquiring about what's available, you have now taken the most important step. And that's the first step towards, acknowledging that you might need a little help. It is a loving, important, productive process full of revalidation. And I started this path 37 years ago. And every day is better than the last. You wouldn't have given me 2 plug nickels to go 37 hours, much less 37 years. But one day at a time, it works. It can work if you put in the work. And so that's what we try to make people understand, that help is available. You don't have to feel the way you feel now.
Love it. Thank you, Geoff. Thanks, Moira, so much. This is really exciting and important, more importantly. So thank you both for your time and look forward to speaking with you all soon.
Wonderful. Thank you, Ken.
Thanks, Ken.